back, and we're moving into our first conversation for this morning as we have a conversation in commemoration of World AIDS Day on the situation of HIV in Belize. Today we have with us Dr. Russell Manzanero, who's an epidemiologist. He's the head of the unit for the Ministry of Health and also an advisor for the HIV program. We also have with us a very familiar face, Desmond Berry, and of course Desmond is an advocate for people living with HIV after he lost his son earlier this year to HIV. Good morning, gentlemen.
Good morning.
And thank you for being here. So, December 1st is World AIDS Day, and Belize had their activities on Friday. Today is really an opportunity to kind of discuss in the larger picture just where we are, what are some of the issues we're seeing, and how the efforts are going to change the situation that we're seeing on the ground. And Dr. Manzanero, I wanted to start with you with just some stats. So the 2018 numbers were released, I think, last month.
Yes.
Can you tell us what the latest update is in terms of where we are with new infections and HIV?
Sure. I guess just a recap on 2017 that we're starting seeing those numbers. We actually started seeing numbers in 220s since 2015 actually. But last year when we did our review of all cases, we started noticing that for 2018 there was a reported 254 cases. So it has gone up a bit. So those definitely we need to look at. As we've been looking at the previous years, the areas of concern are still in the Belize district, Stan Creek and Cayo districts. So those are the areas that are having more cases. Similarly, those are the areas that we are actually doing more testing. So we've been focusing on these areas. Large-scale testing has been carried out at the facilities. We try to do mobiles, and we're actually engaging other entities to actually do testing now, such as BFLA that does HIV testing as well.
Yeah.
So we're trying to expand that. So the testing in itself for this year will increase. But for 2018, we had approximately 40,000 tests carried out.
Oh,
so
that's an increase.
Yes. From the previous years at 35,000, we've had about 5,000 more tests done for 2018. Like I mentioned, 254 new cases, and it's predominantly more in males. So we continue to see that number increase in the male population. In regards to mortality, then it's the same scenario. It's the same areas that we're seeing these high rates of mortality. And we're seeing these deaths as well in males. So it's still pretty much as in previous years as well.
When you look at the figures, it shows that there are 4,915 persons living with HIV/AIDS as of 2018. When you compare that against the total population of the country, it would seem as if though it's a very small percentage. But when you look at it in terms of perhaps regionally, what are we seeing?
No, definitely it's a concern. Even though you see the numbers, for us it's still an alarm. I mean, when you're talking about 4,000 and add individuals who we believe are living with HIV, because that's an estimate.
Yeah.
It's not entirely what we know. So it's individuals who are out there who still do not know their status. So it's just an estimate that we have, but individuals who we know and have been diagnosed, who are on treatment, is probably like 1,400. When you're talking about race, for example, you're talking about over the population, the severity of HIV in Belize. Actually, we are high when you're talking comparing in comparison to the Caribbean and to Central America. So in the Caribbean, for example, we are one of the leading countries that are there with those rates for HIV high. So. And
from your knowledge, why is it that we are seeing so many new cases? Because let me be clear, 200 something it doesn't seem like a lot, but when you compare us to the region, that's where we start to see that we are seeing far more cases than our other Caribbean countries are seeing.
No, definitely. I can't speak about the other countries. I know that similarly they have their own estimates and projections as well. For us, we're seeing that as you mentioned, when you're tying in about other things that might factor into why screenings are not being carried out or why we're not doing more testing, could be many factors. There's so many social issues behind it as well, but there's also the large component of stigma and discrimination which is still present. So even though it is something that we've been coming a long way since the 1980s, we're talking about this, there is still much stigma around it. So definitely those kind of things can actually hinder you from getting tested and knowing your status.
Desmond, this is a great time, I think, to bring you in because there are two things I wanted to look at. Just oftentimes, we don't start paying attention to an issue till it hits close to home.
Yeah.
That's just who we are as humans.
That is true.
How much were you aware of the situation of HIV and what was available and what the challenges were before your son was diagnosed?
I was quite ignorant to the fact about HIV. I knew about it. Magic Johnson came out publicly. That's when I first knew about HIV/AIDS. But here in Belize, I didn't know much until my son got infected. That's when we started doing the research and trying to reach out to the different departments to find out what and how we can do about it.
What was that experience like for you? I'm gathering it's a journey that you took along with your son.
The experience was a very painful experience. To see my firstborn ailing with pain and trying to get the different medications to keep him going. The times he would take the medication, he starts feeling well, he would get off the medication because, I'm okay now. Then he falls back into some kind of a depression or something, then he has to go back to the medical facility to get help.
Yeah.
But he didn't, he was never compliant with the different medical facilities because he would stay in like one day and then sign himself out because he's like, I don't want to stay in there. I just think that it's things like these that the Ministry of Health would need to start training the different people that works along with them to talk to these patients as to like, if you go into the medical facility, you need to stay there until the treatment is over and not walk out before then because that's what brings him down as well. But the journey with him was very, very painful.
Did he receive any form of counseling as he went through this process?
There are times, yeah, he did receive counseling, but for some reason when he hits the depression rock again, it's like he didn't want any part of it.
Yeah. And I think this is where you cannot separate what is a medical issue from what is a physical issue in terms of your physical health to your mental health, but also fitting in within the context of the wider society, because that's where a lot of the discrimination can lead to, degradation in your mental
Because
health.
society doesn't accept that individual once they know that he or she's infected.
Yeah.
That's one of the biggest problems I see in Belize.
Yeah.
I would have thought that we've come a long way nonetheless. I mean, you mentioned in the 80s when Magic Johnson came out as perhaps the first major well-known figure in sports to come forward and say, look, I am HIV positive. I recall being a child at that time, and initially I thought that was something that was in America.
Not in Belize.
Until I had my own experience meeting someone or learning that an individual who was in the neighborhood where I grew up was also HIV positive and had been living with complications for quite a while before he passed. And so the stigma back then was very strong. We're talking in the 80s, early 90s. But for some reason, I believe perhaps the conversation has become commonplace, where I thought it's not as strong as perhaps back then when we were ignorant to the whole issue of HIV/AIDS. Do you believe that it's sort of tapered down, or it's still very much present in terms of the stigma?
No, as you mentioned, we've come a long way, indeed. I mean, from the first years when we started with it, and it was so pronounced, the stigma was there. I mean, the efforts that everybody has been putting into it, not only health, but other individuals as well that work along with us, to disseminate information. It's actually sensitizing the public, the knowledge behind it, the education behind it as well. HIV is now termed a chronic illness, so that means that if once you are infected, you can stay on your medication, change your lifestyle behaviors, as we do for diabetes and hypertension, you can lead a normal life. So that's where we're trying to work at and to do that. Mr. Berry mentioned something about Ministry of Health probably looking at different ways with how we can get individuals to stay on board. I do agree, and we're working at that. So we have continuous training with our personnel as well to do all of those. I mean, but a part of it, and I think where we need to look at is patient readiness. That patient readiness in itself means that you need to be mentally able to want to start treatment. I need to accept my status. I need to be able to do the things that I need to do to make those changes. We cannot tell you as a medical officer, as a healthcare provider, that you should be on treatment, on start treatment. When you start to do these things, and it's similar to all the chronic illnesses for diabetes, hypertension, and cancer, that you know this is what you need to do, and this is something that I need to accept. So until you are ready and you know that you're going to start the treatment and stay on it and do these lifestyle changes, then that patient readiness is when we can say, okay, this individual can actually stay on treatment and continue on treatment. However, with that comes the counseling and everything else.
Yeah.
So it is, and we do recognize that mental health in Belize is something that we're not focusing on fully. It's still something ongoing, and we need to get more of that addressed in the health system too.
Well, you know, and you mentioned diabetes, and I think to myself, I know so many diabetics who don't maintain their medication, their diet, you know, all of these things. You're right, an acceptance of your diagnosis, and also being able to recognize that the life I had before is over. The new life, which isn't a bad one, will include these additional steps. And that's a big shift for any individual to make. But what is different with HIV versus diabetes is the real stigma that people face. And I'm still fascinated every time, not even fascinated, it's disgusting when I still hear stories of people being ostracized by families. You know, they don't want to touch them, they don't want to share cups or plates or all these things that cannot transmit the disease, to be clear, or even, you know, losing their jobs over their status being known. So you have this very real issue of being treated poorly as a result of having a disease that, you're right, people can live with.
Yes.
How do we work towards overcoming that? I know, Desmond, this is your personal experience.
Family counseling, I think what the ministry could do is, like, because they know these individuals that are positive. I think what they need to do is to get into that individual home and speak to the family members to let them be aware of what can happen and what cannot happen.
Yeah.
Because of the absence of that counseling, even the family members are very ignorant to it.
Yeah. But Desmond, what was the difference between you and these other families that, you know, I've interviewed people that live in a shack in the backyard. They can't go in the main house. What's the difference between you and other families that ostracized? Why were you so open to helping your child through this journey?
It's something that it's a choice that he made from the get-go, that he wanted to be open about it. He didn't want to hide it from anyone. I mean, so our support was key. And loving him, not putting him somewhere else to sleep, but instead in his room, in our home, was key to keeping him like going until he couldn't go anymore.
No, I'm hearing, Mr. Berry, and of course, one of the biggest things that we need here is support. I mean, the family support is so key. That when somebody is with any illness, then you need to have that support to actually keep going and to do all those changes as well. I mean, he is mentioning that we should offer some kind of support. Indeed, it's true. And in that, we're trying to look at working along with new individuals. We call them adherence counselors. To actually go out and seek individuals who need that kind of support. We're going to work along with the social workers, of course, and mental health. So it's an integrated system that we are actually trying to work with them. But these individuals would follow these individuals who might actually have a difficult time to adhere on treatment. And these are the ones that we're going to try to work with even more. Similar to what we do. We already do this with TB. So we're trying to look at different ways that we can do it as well for HIV.
I think one of the conversations that shouldn't be lost in this broader discussion that we're having here is the scarcity of treatment. And I know it's a discussion that is ongoing, considering the fact that the ministry has been trying to source medication from other areas. In terms of outreach and dealing with persons who are living with HIV/AIDS, what has that been like, knowing that, you know what, there's a serious shortage of medication to provide for these individuals?
Probably I'm not too clear on the question, but just to highlight on the access to services. When you're talking about access to services, it includes the entire package. It's the integrated way of how we're going to do it's the treatment, the care, the follow-ups, the adherence. And in one part is the medication availability, which of course there is some shortage, as you mentioned. However, when we look at those things, it's trying to overcome and see where we can get those medications to always be available. We do recognize that there are some issues right now with our suppliers.
Yeah.
And it's definitely so that, even so that to get these medications on board, I know discussions were that we don't have the money or we don't know. The money is there. We work with a set budget every year, and this is the monies that we have for everything, testing, kits, milk for babies who are exposed. All of these come out of the budget.
Yeah.
So we have that money, but when we do the process of actually procuring the medication, it has taken a lengthy time. And when you're dealing with individuals, I mean, we do get them from an Indian company or other companies who are WHO certified. So they need to meet standards as well. But the delay in the process of actually getting them in the country is somewhat, it's troublesome when you try to hear. And these are the issues that we recognize, that when you hear them say, oh, we can't supply the country because it's a very small production or because there are mass productions in other areas, it's something that we need to address. Other ways that we've been dealing with it is actually getting assistance from PAHO as well, to actually look at different ways that we can get the medications in as well. So, so that is something that we're trying to look at too, so definitely.
Yeah. You know, it is a concerning situation, and while I think that the explanation does allow us to understand a bit more from the ministry's end, you know, for the individual who's looking at 2 pills left and know the consequences of stopping the medication. I mean, this is life or death. This let's not mince words. This is perhaps developing a resistance to the medication, not having one that will work on them, diminishing health. And so the consequences, I feel, are just way too grave when you talk about what has taken place with procurement. So my question really has to do with realizing now that this is an issue, and it's one that I'm very sure, knowing people in the Ministry of Health, that you guys are not happy with as well. What will be done to ensure that there is a constant supply?
The medications of present, I know you're talking about a shortage,
Yeah.
you mentioned it, but it's not all. It's not all the medications. It's actually just a certain regimen that we stocked out. So when you're talking about that, it's actually looking at ways that case management of cases. So you look at the cases, for example, a majority of our patients are on this specific regimen.
Okay.
So we've done training with physicians and healthcare providers that there are other regimens that are available and still here in Belize as well. However, to keep the constant flow is that we are actually getting assistance from member states, or we're getting assistance from PAHO.
Yeah.
So those kind of medications are here. We already have the medications in the country.
Okay.
So those are no longer an issue.
to know.
But to get the constant supply from these suppliers is what we're trying to look at too.
Yeah, yeah. And to be fair, as you've said before, there are a lot of services offered by the Ministry of Health. One, you get tested for free. That does come along with counseling. You get medications for free in this country as well.
Yes.
And you also get, because we have the testing machine for the viral load, you also get your viral load test, which means you can actually get the virus suppressed in your body to the point that it is undetectable.
Yes.
Yeah.
Yes.
So these are all great. I think they're definitely necessary steps that's been taken by the Ministry of Health. So you have all these services, but what we need now are the people to get tested, to get on the medication, and to stay on the medication. So it's really about being able to communicate to people why we should be paying attention to HIV and following through with, or starting off with just getting tested. And how do we get there?
I mean, we have, I have to talk about the NAC.
Yeah,
I mean, the National AIDS Commission is there, is a secretariat who looked at all of that.
Yeah.
I mean, the Ministry of Health is there to do the care, providing the care, the services, everything is there from our end. But I believe the bigger picture, that what you're trying to allude to is more the response.
Yeah.
The response in itself is much more than the Ministry of Health.
Yeah.
And the National AIDS Commission is there to look at the coordinating bodies.
Yeah.
Everybody who should be there at the table to address the response. So when you're talking about education, sensitization, coordination, communication, education, all of those things is what the National AIDS Commission looks at. And there are many partners that sit on that AIDS Commission that should be working together to address these kind of issues.
Yeah.
So these are the things that we're trying to work with the National AIDS Commission, because we do have our part as the Ministry of Health, but there are so many others that will actually fall in place to actually address a response, so definitely.
And we know that discrimination is one of the top issues that we keep on talking about as well, because discrimination will stop you from even getting tested.
Of course.
And that's the first step in terms of knowing your status. Desmond, that brings me back to you for a second, because where we have been able to talk about how your family was supportive to your son, his challenges lied in the wider community.
Yeah. In the workplace.
He lost his job.
Yeah, he lost his job on 3
Did
different
they
occasions.
tell him it was because of HIV, or it was just one of those things that you knew?
I knew it was that because he was a hard worker. He never had issues with anyone at the workplace, and some of the guys that he worked with would complain because he would have to take time to go take some kind of medication or something, and they were like all annoyed because like, oh, he has to take time off, you know, and sooner or later they would just like give him a letter saying, oh, your service is no longer required.
But ought they to have made some form of accommodation knowing what the condition is in respect of this
I wish they
employee?
would, but most employers, they're just like many, they're ignorant to the fact that, you know, this is not a disease that by shaking your hand I'm going to get it.
Yeah.
You know, and they need to do their part as well as to educate their employees
Yeah.
about the disease.
Yeah.
Or like the ministry would like, to me, get into the high schools and do some kind of educational program about it, because there's so much, how can I say this? There's so much activity, sexual activities happening in the high schools or in the at the primary level. I mean, and these kids are experimenting sex to a level that when we were kids, we had never thought about these things. So therefore, to me, I think the ministry needs to get in there and start doing something about it, because I'm pretty sure if they do some kind of AIDS testing in those schools, it would be like alarming. It would be alarming. I'm pretty sure of that.
Probably just to highlight that we do work along with the Ministry of Education. I mean, there are instances that we do go into the schools, we go to the high schools as well, to that level to give this kind of education and communication around the topic. So it's HIV, STI, CB. So that's what we work with. But indeed, this is where, as I mentioned, the AIDS Commission comes in, and these are the agencies that should be aware and actually be working along with us as well. So definitely there is a need to look at these things. So.
Yeah, and not to be, we need to be clear and say we are making some progress. We're seeing less, well, there's a little increase from last year, but it's not the spike that we saw earlier. A few years back with HIV. But I want to ask you, Dr. Manzanero, as the epidemiologist, from all the data that's been collected, what particular area concerns you the most? You look at the numbers, you see where the trends are. What concerns you the most?
I think it's getting individuals to recognize that they need to get the testing done. I mean, we've been doing our part. I mean, we keep pushing to get tested. We take individuals out from the facilities to go to the regions. They're going to go out there and hold these mobiles, come and get tested. So the public awareness, perhaps we need to look more at that. We need to actually look at different populations as well that we need to target.
Yeah.
I mean, I
The
understand
elderly?
and I hear different things. When you look at the age groups, of course, we know that, as you mentioned, individuals are sexually active. I mean, from a very young age, these things, but the exposure that they have now is there at their hands, that they get this kind of information. If we don't give them that information, they're going to go and get misled somewhere else. So that's one population that we need to work at, the younger population, but we also need to look at the later stages. What is happening? We're trying to understand why now these trends of why there's an increase in the older population. Why is it now that we're seeing over 50 getting tested and becoming reactive? So these are things that we need to look at. What's the nature of it? And of course, we need to do some
I'm so
more
glad you
research
brought
on
that
it.
up. I did a story last week on that very same issue, and you know what it made me realize is that there are no messages for people over 50 to get tested. And I don't know what the 2018 stat says, but the last two, 16 and 17, clearly shows that that is a population that is being registered as new infections, almost 20%, 15, 20%.
Oh, definitely. It's not only Belize, but we're trying to look, for example, when you're looking in the region, for example, it's something that is an alarm that we're starting to see that after 50, we're starting to see increase of cases, particularly in males as well. So what is happening? And then we're trying to see an increase of younger women becoming exposed, in the earlier ages. Of course, when you talk about the testing numbers, you're going to see more women test.
Yeah.
But we need to factor in that this is part of their screening as well for adults and health,
Yeah.
pregnancies, MCH, the maternal child component, that's their strong and their forte to actually be screening for these kinds of things. So we know that women are, and we capture that, but we need to be a little bit more for men, targeted for men.
Yeah.
I think even with the generation gap, I think it's something that we haven't been discussing.
Yeah.
But we really can't tailor messages to an older population, and the younger population is quite different. I mean,
Yeah.
the disparities there is clear. So we need to be very innovative, I think is the word, of how we're going to target the young population who deals with the media, and the older population, as you mentioned, that there are different ways that we need to approach, and we just can't tailor for one.
That's right. Well, we're completely out of time, and I knew this conversation was going to zip by. I just want to ask you, Desmond, with your experience, I think you could give us the closing thoughts in terms of just reminding people why they need to be more caring and compassionate to people who are living with HIV.
I just think that if your son or your daughter, your brother or sister come and say, you know what, I got tested and I'm positive, show that person love. You know, that's to me, that's the main thing that would keep that person or want to take his or her medication is love. If you don't show them love, and they won't get it out there. There's no way they're going to get the love out there, because everyone is going to be like, no, I'm not going to, you know. Or if they have a partner, that partner support is very key.
Yeah.
Not to walk away from that relationship because he or she is infected, but instead get the necessary information as to how you can continue in that relationship, being active with each other.
Yeah. All right. Thank you for just a brief conversation on HIV this morning. And once again, the testing services are available at the Ministry of Health clinics, and you can get it for free. It comes along with counseling, and if you are positive, you do get your medication for free as well. So know your status, please. We're going to go ahead and take a break. When we come back, we'll be talking to representatives of the Belize Hotel Association. So please stay tuned.